All right, we have made it to our last section for the nursing process. So this is the step called evaluation. And this is the last part. So this is awesome. Yay! So in the evaluation stage, what we're doing is we are making sure that our interventions, the plan we implemented for the plan of care, has met its goals. So the goals are the outcomes that we created in the outcome planning part of the nursing process. So this is kind of like the check to make sure that we have done everything, or if we need to change something, and we're evaluating if what we're doing is working. All right, so evaluation is the last step of the nursing process, allows achievements of outcomes, directs interactions between the patient and the nurse, measures the outcome achievements, identifies factors to achieve outcomes, and helps modify the plan if needed. So what I mean with modifying the plan is if we're not reaching our goals, we're changing it and doing different things so that we can reach our outcomes. In previous steps, we learned about 3 different types of outcomes. We are adding one more outcome to our evaluation step, and we will discuss that in the next slide. All right, so we do remember the first 3 outcomes that we talked about. So cognitive is one that increases the knowledge of the patient. Psychomotor is when a patient achieves a new skill or learns a new skill. 3 is the affective one, which changes in patient values, beliefs, and attitudes towards their health or whatever brings them into your care. And the last one we're adding is called physiological, and that is physical changes in the patient. That can be anything like weight loss, changes in vital signs, and things like that. Again, remember, cognitive is they are increasing their knowledge. So example of that could be the patient lists 3 ways to cope with their anxiety. Psychomotor skill or psychomotor outcomes can be the patient will be able to ambulate with their prosthetic for 10 feet by the end of the shift or something like that. So that one is the patient learning a new skill. And the affective one is when the patient changes their values, beliefs, and attitudes. So that could be anything like by the end of the patient's rehab stay, they will be able to tell you 3 ways to cope with their anxiety towards their addiction. And so those are just kind of some examples of outcomes. Physiological outcome would be by the end of the month, the patient will have lost 10 pounds. That is the physiological outcome. So why is it important to know the type of outcomes? Well, with knowing the type of outcomes we are trying to achieve is then we know if the patient has met them or not met their outcomes, and that is how we evaluate the plan of care. There are 5 classic elements of evaluation. So the first one is identifying evaluative criteria and standards. This is what you are looking for when you evaluate. collecting data to determine whether these criteria and standards are met. So this is kind of like your ongoing assessment and collection of data, interpreting and then summarizing your findings. And this is again collecting all that data and then making inferences and being able to summarize what you found, documenting your judgment, and then making your decision of whether you're terminating, continuing, or modifying your care plan. A lot of the times, especially in facilities, they'll have sort of kind of like standards of evaluation and how you would document those. Once you've gone through the 5 elements of evaluation, you are able to make revisions in the plan of care or completely finish it or delete it, modify it. So you need to be able to understand those 5 classic elements so that you can make a judgment and be able to revise your plan of care. So one of the ways you can revise it is delete or modify the nursing diagnosis, make the outcome statement more realistic, increase the complexity of the outcome statement, adjust time criteria in the outcome statement, and change nursing interventions. So deleting or modifying the nursing diagnosis would be if you had an outcome of the patient, if the nursing diagnosis was a risk diagnosis, a patient is at risk for falls due to confusion as evidenced by disorientation, impulsiveness, and your outcome or goal for this patient can be something like the patient will remain safe by the end of shift. And unfortunately, this patient ends up having a fall. Well, maybe something's needed to change, so you need to revise your care plan. On the other hand, if the patient stayed safe and we were able to reorient them and keep them from falling, then we might not need to make a modification. So, so make the outcome statements more realistic. Always remember that you need to include time criteria with your plan. And sometimes we need to change nursing interventions to help that patient reach their outcomes. The following are nursing actions based on the patient's response to the plan of care. So one of them would be to terminate the plan of care. So the plan of care, when each expected outcome is achieved, you terminate it because you have reached all the outcomes, so no need to continue that plan of care. Modify would be if the plan of care has some difficulties in achieving outcomes. So that is, that one would be where you evaluate and see why certain things aren't happening, why they aren't making their goals, and make changes as needed. Continue the plan of care would be maybe if you need more time to achieve the outcomes, maybe the patient is just progressing a little bit slower than you want, so you would just modify in a way to continue that same plan of care, but giving more time so that the patient can achieve their goals. Once the nurse has decided how they would respond to their plan of care, it's always important to make sure that the patient is involved. Ideally, that partnership you want that to be throughout the whole nursing process. You want that patient involved in every step of the way so that they are likely to achieve the outcomes as best as possible. As part of the documentation part of your evaluation, your documentation needs to be specific to that plan of care and those outcomes. So if your goal was the patient reports, you want the patient to report 1 week of no tobacco, then you would document that as by 1/21/2022, the patient has met the outcome. Patient reports 1 week without tobacco use. Or say if they report partial tobacco use, then the outcome was partially met. Patient reports that they decrease their use of cigarettes and have only smoked maybe 1 to 2 cigarettes per day. You would then continue and modify that plan of care based on the information you have. The last one would be outcome not met, and that would be if the patient would have reported tobacco use every day, no changes to their tobacco use, and then you would reevaluate and see what you need to do to change it so that this patient can meet their outcomes. All right, you guys have made it to the final slide of evaluation. So coming up next would be your PowerPoint on delegation.